Hey, welcome. We hear words like anxiety, depression, and bipolar thrown around all the time, but what do they actually mean? Well, this explainer is designed to be a straightforward guide to cut through all the noise and make the language around mental health a lot clearer. So, let's dive in.
We all feel sad sometimes. We all worry. That's just part of being human. But when does a bad day cross the line into something more? That line can get really blurry, right? And that's the big question we're going to tackle today. What is the real difference between an everyday emotion and a clinical condition?
So here's our game plan. We're going to start with anxiety, or what happens when worry takes over. Then we'll get into mood disorders, navigating highs and lows. After that, we'll look at some deeper patterns of self, and finally, we'll bring it all home with the path to support. It's a clear roadmap, so let's get going.
All right, let's kick things off with part 1, when worry takes over. This is all about anxiety disorders, those conditions where feelings of fear and panic become so powerful that they start getting in the way of everyday life.
A lot of people think agoraphobia is just a fear of open spaces, but it's actually way more specific. It's this intense fear of being stuck somewhere. Think a crowded airplane or a long line at the bank, where you feel like you couldn't get out if a panic attack were to hit. It's the fear of being trapped.
And make no mistake, anxiety isn't just in your head. It's a full-on physical experience. We're talking about real symptoms like your muscles tensing up, your heart racing, sweating, shaking. It's like your body's internal alarm system is just stuck in the on position.
But what happens when that anxiety isn't tied to one specific thing, like being on a plane? Well, that's where generalized anxiety disorder, or GAD, comes in. With GAD, the worry is just constant. It can be about your job, your family, your health, pretty much anything, and it's there most days, making normal life a real challenge.
So what actually helps with this stuff? Well, treatment is usually a multi-step approach. Step 1 is often therapy, like CBT, which helps you learn to reframe your thought patterns. Step 2 might involve medication to help with the underlying brain chemistry. And Step 3 is all about support, things like relaxation techniques. The biggest takeaway here is that anxiety is absolutely treatable, and finding the right combination of strategies is the key. All right, let's move on to part 2, navigating highs and lows. Now we're getting into mood disorders. And these are way more than just your typical mood swings. We're talking about huge shifts in emotion, from really deep, lasting lows to, in some cases, incredibly energetic highs.
So first up is major depressive disorder. Two things are absolutely crucial to understand here: how long it lasts and how much it affects you. This isn't just feeling down for a day or two. It's a persistent low or a total loss of interest in things you used to love that goes on for at least 2 weeks and really impacts your ability to just function.
To get a real handle on this, clinicians often use a handy mnemonic, SIGCAPS, to check for symptoms. And this really shows you how depression is so much more than just sadness. It messes with your sleep, your energy, your ability to concentrate, even how much you eat. It's a condition that truly affects every single part of a person's life.
Now let's look at the other side of the mood spectrum, bipolar disorder. And the name itself actually gives you a huge clue. Bi means two, and polar means opposite ends. This condition is defined by those big swings between the lows of depression and these intense, energetic highs, which are called mania or hypomania.
So what does that high pole actually look like? Well, here's another great mnemonic for it: dig fast. This helps clinicians remember the signs of a manic episode. We're talking about everything from being easily distracted and super impulsive to having these huge, grandiose ideas and feeling like you don't even need to sleep. It's a state of really high energy that can have some pretty serious consequences.
So what's the big difference between bipolar 1 and 2? It really all comes down to how intense those highs get. Bipolar 1 means you've had at least one full manic episode, which can sometimes be so severe that a hospital stay is necessary. Bipolar 2, on the other hand, involves a less intense high, which we call hypomania. But, and this is super important, both types also include those episodes of major depression.
Okay, let's shift gears a bit for part 3, patterns of self. Here, we're going to talk about personality disorders. The key thing to understand is that these aren't temporary states or moods. They are deeply ingrained, lifelong patterns of thinking and behaving that can cause a lot of distress in a person's life.
A major example is borderline personality disorder. And if there's one word to remember here, it's instability. That instability shows up everywhere, in moods, in relationships, in a person's sense of who they are. And so often, this is all driven by a really powerful, deep-seated fear of being abandoned.
Now, as a bit of a contrast, you have avoidant personality disorder. Here, the main theme isn't instability, but overwhelming avoidance. And it's not that people with this condition don't want to connect with others. They often desperately do. But that desire is overshadowed by this profound fear of rejection, a feeling that they're just not good enough.
Okay, so we talked about a lot of complex stuff. The big question now is, what does getting help actually look like? That brings us to our final section, Part 4, the path to support, where we'll look at how professionals figure this stuff out and what treatments can really make a difference.
And just to show you why professional help can be so urgent, let's look at something related: alcohol withdrawal. A lot of people use alcohol to try and cope with the conditions we've been talking about. And this timeline shows just how quickly withdrawal can go from mild symptoms to a full-blown, life-threatening emergency. It's a really powerful reminder of why medical supervision can be absolutely critical.
So what actually happens when you go for an assessment? It's probably not as scary as you might think. A professional will just observe things, like your appearance and your body language, and they'll pay close attention to this key difference: your mood, which is what you tell them you're feeling, versus your affect, which is the emotion they can actually see on your face.
Think of this as a snapshot of the main tools in the treatment toolbox. The most important thing to see here is that there's no one-size-fits-all solution. Different therapies, like CBT or DBT, are used for different needs. Same goes for medications, from SSRIs for depression to mood stabilizers like lithium for bipolar disorder. The goal is always to find the right tool for the right job.
This quote, I think, really sums up the whole point of our discussion today. The whole reason we're doing this is to build that very first step, awareness. When we understand the language and can recognize the patterns, we're so much better equipped to take the next steps, whether that's for ourselves or for someone we care about.
And that leaves us with one last question. Now that we have a better handle on the language, what do we do with it? How can we all use this knowledge to have better, more empathetic conversations, to help reduce stigma, and to really, truly change the way we talk about mental health? Thanks so much for joining me.